This is the monthly Zoom educational program. This month, we're collaborating with Healthcare for All Washington is collaborating with Physicians for a National Health Program Washington to present this program. Thank you all for responding or sending in your RSVPs and for joining us tonight. And let's hang on for just a minute, and then we'll start the introduction. So, welcome to our monthly speaker series. My name is Ronnie Shure. I volunteer as president of the board of directors for Healthcare for All Washington. And we are collaborating with Physicians for a National Health Program, Washington chapter, to present tonight's program on standing with our Somali neighbors. It's shameful that the president of our country is using lies to spread fear among different groups in our country, and there's just no excuse for someone leading our country to use the kind of language that he's using. And so I have a brief message. If I don't think Trump is listening, but I bet somebody from Homeland Security is there. But I would like to make a suggestion that as President Trump plans the 250th anniversary of our country, I suggest that he listen to a political philosopher from 250 years ago. Edmund Burke was actually a conservative philosopher, but he really supported the American Revolution from his English or his British political position, and he said that belonging to a religious group or an ethnic group or any social group is the first link in the process to building the love of a country. Tonight we are taking a step toward understanding our Somali community in our neighborhood and follow their sacredness, to open our hearts and to have a friendly conversation this evening. David, you want to add something?
Well, I'm David McClanahan. I'm the coordinator of Physicians for a National Health Program, Seattle chapter. And I worked at Pacific Medical Clinics and also a couple of the International Community Health Services and Country Doctor for 25 years. So we took care of a whole lot of uncompensated patients there. So that's my background, but it's really an honor to help with Ronnie to share the voices of Amina, Anisa, and Najma with you tonight to find out what we can do to amplify support for the community, for their community during these shameful times when our national government is harassing them. It's also an honor during International Women's History Month to hear from these powerful women. Thank you for all being here tonight.
Well, thanks, David, for those comments. So you'll find that in the Zoom chat, we are posting a link to our website where you can find a donate button. Then you can navigate to get involved if you are interested in volunteering, helping out with just one particular project. You don't have to volunteer for some permanent ongoing committee, but please follow that link in the chat. And if you are able to make a donation, please do that. You can use that link to do that. Every donation helps us move closer along this pathway to universal health care. We've set a goal to raise $250 tonight during this program tonight. So you can go to the chat anytime and during this presentation. We also ask that you use that as a place to put your questions as we go through tonight's presentations. Please go ahead into the chat and add those comments or questions in that chat portion. David McClanahan will also share links to the Physician for a National Health Program, Washington's website, and an interesting program that they just unveiled last night on moral injury among healthcare providers. So bookmark us, save those websites for both Healthcare for All and for PNHP. Tonight we're going to have a presentation, and during that presentation, like I said, add questions in the chat, and we will have a Q&A session immediately following the presentation. I am participating in this Zoom meeting tonight from the lands of the Coast Salish people, so please take a minute to acknowledge the peoples and the lands where you're joining us from today. We do have people from all over the world tonight. We acknowledge all of the ancestral homelands and the traditional territories of the indigenous peoples who have been here since time immemorial. Almost all of us are immigrants to the indigenous homeland of these peoples. So we walk the pathway to universal health care using the teachings that we learn from indigenous people to remember the lessons of life and to preserve our lands. When we thank the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Muckleshoot, Puyallup, Suquamish, and Tulalip nations. So let's bring in Amina Ibrahim, who is joining us very early in the morning from Cairo in Egypt. Amina is a graduate of Seattle University, where she received a plethora, a whole bunch of student awards, and graduated magna cum laude. She also spent a year studying abroad at the University of Ghana. She's an accomplished journalist who has really been a great help. Thank you, Amina, for helping organize this presentation, this panel tonight. You've gotten experience with Crosscut on PBS, with Radioactive Youth Media and KUOW, and the Council of American Islamic Relations. So thanks for all of that work and for transitioning to public health advocacy, both on a local and a global level. So thanks for joining us tonight from Cairo, and just remember to, as she introduces the other speakers on the panel, to put questions into the chat. We'll be tracking that, and we will have a Q&A session immediately after this. So thank you. Let's bring up Anisa and Najma. So unmute yourselves. Take it away, Amina.
Thank you, Ron, so much for that introduction. I am so pleased tonight to be moderating this conversation with Dr. Anisa Ibrahim, the Clinical Associate Professor of Pediatrics and the Medical Director at the University of Washington, Harborview Pediatrics Clinic, and Najma Osman, the Co-Executive Director of the Somali Health Board in King County, Seattle, Washington. Could each of you guys briefly share your role and what drew you to serving the Somali community?
Yeah, I could go first. First of all, thank you for inviting me. It's an honor to be here and to be a part of this panel. Dr. Anisa, it is so wonderful to see you. And yeah, it's a pleasure to have Amina moderating today. My name is Najma Osman, and yeah, like Amina mentioned, I am the current Executive Director of Somali Health Board. My path to public health have honestly been rooted from being inspired by my family, seeing unfortunately, the health disparities that people that look like me face in healthcare. I was introduced to public health through this Public Health 101 class, an undergraduate class that I took at UW, was inspired. Ever since then, my work and background is in healthcare policy and advocacy. So to be in this role today, I'm super grateful to be in a position to actually provide impact to my community. Yeah, and then I'll pass it to Dr. Nisa.
Thank you, Najma. It's a pleasure to be here tonight. As Amina mentioned, I am a general academic pediatrician, and my specific expertise is in refugee and immigrant health. So I am, first and foremost, a care provider. I work at Harborview Medical Center, and I completed my training here in Seattle, Washington, where my family first came. We were resettled many years ago now, back in the early 90s when the political environment in our country, at least towards immigration, was in a much different place. I think a lot of my role is, what I would absolutely love doing is twofold. And one is caring for patients. I love being in the clinic caring for patients, and many of my families are newly arrived children with medical complexity, which is very difficult to navigate. And we have the honor of joining families as they do that. And then for my entire career, and even prior to my career starting, I have been, at the interface of where community meets healthcare, with the inception of the Somali Health Board way back in the day when, there wasn't a health board. We were trying to figure out people were trying to figure out how to create it and what does it mean to value community and expertise that is not identified by, certificates and papers, and how do we honor the elders' language, and how do we communicate effectively as physicians to the communities that we serve. And I think that has really been the needle that's kind of threaded through my career. How do we serve those who are not just underserved, but strategically marginalized? So yeah, let's stop with that.
Yeah, thank you guys so much for sharing that. You guys kind of touched a little bit about your guys' families. Can you briefly describe the Somali community, your personal immigration, or your family's immigration to Seattle? Could you also share a few contributions you have made and give examples of leaders in the community, whether it's local business leaders, education, healthcare, religious spaces?
Yeah, sure. I can go first. So, I came to the United States in the early 90s. I was young. I was 6 years old. So I started a lot of my schooling here. And I think right now we have a huge, vibrant, phenomenal Somali community here in the Seattle area, where we have really, this is our home. We are contributing members of society. Not that should ever determine a human being's value. But we have really embraced the Seattle area, the culture. Our children are here. They are professionals in every sector. They're leaders in the community. They have really set their roots here in the Seattle area. But when my family arrived here, we can count on probably two hands the number of Somali families in the greater Seattle area. There was not many in that time. And over the years, it's been really inspiring to see how through lost relocation, this community has really built itself back up through resilience and community connection, and adapting, and assimilating, but really holding on to the things that we value as a culture and as a community, and building our spaces kind of around that. And many of the teachings of, our elders really held in saying, stay true to who you are, be a hard worker, be, the teachings of not only our culture, but also our religion. I think the Somali community now is huge, and it's just like any other community. It's incredibly diverse. It has grown significantly. And with that growth, we've seen opportunities increase. We've seen, things that were a long time ago stigmatized, addressed. We've seen healthcare change, our approach to schooling, all of these things really shift as we kind of intermarry, holding on to the things that are important to us, and then also adapting and adjusting to what we have now. I shy away from speaking about myself and my personal contributions, just I think, but I think as a physician, I have really dedicated my life to ensuring that I am there with my community, that I am seen and I am an advocate for them. And honestly, with any community, I think valuing the people who we learn the most from, valuing the things that mean the most to us, and not being afraid to be visible. As you see, I am a visibly Muslim Black woman, and there are many spaces that tell us to be quiet and be timid and not speak up. And if we think about how I truly believe that healthcare is a human right, then for me, that being silent in spaces where I can make a contribution, whether it is in the clinic or through the community work, through many different organizations, including the Somali Health Board, or nationally, when I have served on the Council on Immigrant, Child, and Family Health, or Society for Refugee Providers. It's a duty to be able to speak up and speak up for what's right, even if your voice shakes. I think that's the number one thing that I've learned in my career, and I think that I will consider my biggest contribution. It's being brave enough to speak up.
Yeah, I love that answer, Dr. Anisa. The Somali community in Washington is really a well-established East African immigrant and refugee presence with strong roots across South Seattle, SeaTac, and Tukwila. Over the past 2 decades, we've seen significant growth in Somali-owned businesses, restaurants, markets, small enterprises as well, which not only function as economic drivers that directly impact our community, but also cultural and social anchors within the community as well. We're also seeing there's quite a few political representation in the leadership and governance roles. We're seeing growing civic engagement and leadership across Washington state. For example, leaders like former council member Muhammad Abdi of Tukwila, the mayor of SeaTac, Muhammad Igal, council member of SeaTac, Badri Abdullahi, to name a few. And they represent the kind of civic leadership and representation that is continuing to grow. Personally, I am the daughter of Somali immigrant parents who are both entrepreneurs. So I kind of grew up with that direct understanding of both the structural barriers and resilience within our community. I'm also a first generation college graduate, pursued my master's in public health, which shaped my focus on health equity, systems change, and community centered approaches to care. And really what we're seeing in Washington state and across the country is that we're seeing more and more Somali professionals stepping into leadership roles across healthcare, education, public service, which is critical for long-term representation and improved outcomes. And in terms of my own contributions, my work has been focused on advancing health equity through advocacy, public health programming, and community engagement. And my passion really is bridging that policy and advocacy and direct community engagement, making sure that we're creating spaces for community voice to actually shape programs and policy. And that's a lot of the work that we do at Somali Health Board is really being responsive to culturally responsive, but also timely, and ensuring that our programs always reflect what the community needs, adjusting to impact, adjusting based on feedback, and tailoring our programs based on community need. And in my role at Somali Health Board, I continue to focus on strengthening systems so that they're more responsive and actually accessible for the communities that we serve.
Thank you both for highlighting your guys' contributions and the amazing work you guys have done in the community, as well as the work that the Somali community is doing. I love hearing about it. Najma, this next question is really for you. Could you highlight some of the work that the Somali Health Board does in the community regarding advocacy, health education, and healthcare access?
Yeah. So at Somali Health Board, our work is centered on addressing gaps in access, in quality, and trust within the healthcare system. We collaborate heavily with King County, as well as the city of Seattle. And the organization was actually founded by Somali public health professionals, local professionals who came together after recognizing significant gaps in how the healthcare system was serving the Somali community. I'll give a shout out to Dr. Anisa as being one of the founding members and a part of really shaping the beginning of Somali Health Board. And that pivotal work. And that foundation really continues to shape how we approach our work today. We do this through a combination of culturally responsive health education, care navigation through our case management system, and advocacy. We ensure that our community also has access to culturally responsive mental health services. We contract with culturally responsive mental health physicians. Our key part is really a key part of our approach is that our work is not only culturally responsive, but community informed. And as I mentioned earlier, we continuously shape and adapt our programs based on direct feedback from community members. And so we continuously shape and adapt our programs based on direct feedback from community members, which allows us to respond in ways that are relevant and timely. And our programs range from really all cycles of life, from a pregnant woman to our senior program. It ranges from our maternal health, behavioral health, youth engagement, and all of our programs are designed to reduce barriers and improve outcomes in ways that align with the community's cultural and linguistic needs. And one of the things that we also do and always work on being strategic and intentional about is that we don't see direct service and system change as separate. So we're always bringing that conversation based on like what we're hearing from our community, what services that we may be directly doing, but not necessarily getting funding from, always bringing that conversation to places of power and leadership and making sure that our community has voices at that table. And we're always supporting individuals and families in real time while directly working with institutions to improve how can care be delivered at a broader level that is culturally responsive and ensuring that even if our community is not present, that their voices are always there at the tables that are making these decisions.
It's amazing. Community informed work is always so important when creating programming. So I love that there's like a feedback loop when creating different programmings at Somali Health Board. Anisa, I know that your expertise is caring for immigrants and refugee populations in the clinical setting. How would you say the political state of our country has impacted the health and safety of your patients?
I mean, not to sugarcoat it, but it's essentially devastated. The U.S. has always had a very long history of welcoming refugees. Our refugee resettlement program was actually implemented under a Republican administration. It's never been a partisan issue of whether or not we should humanely allow people to seek asylum as human beings who are running away from danger, political warfare, et cetera. And every year there is a presidential determination that determines the number of refugees that U.S., the richest country essentially in the world, should resettle and welcome. And it's always been historically high. The largest number of refugees ever were actually welcomed under a Republican president. So not until most recently, I'd say the past decade, 15 years, has this become a political issue where immigrants is used as pawns in whatever thing that we're dealing. And it significantly affected the number of refugees that we've settled. So starting January 2025, essentially, we have shut down our refugee resettlement program. And this year, the presidential determination essentially said that we would allow around 750 people from South Africa, white people from South Africa, and nothing else would be, no one else would be coming in. In addition, I think this administration particularly, both the last time and this time, operates with the chilling effect. So they will say very scary and often illegal things to cause this chilling effect in the community, to make people afraid to seek care, to make people afraid to seek services that they are qualified and eligible for, to scare children from going to school, to increase the levels of stress that parents who are hardworking and just trying to do the best for their children, to the point that it makes it hard to function in society because you are afraid of stepping outside of your door. So I think it is essentially, warfare when some of my patients are afraid to be who they are and access care and even come to see me because they don't know if they will be profiled. They're afraid to send their kids to school. And we know that isolation has significant mental health effects on everyone, but as a pediatrician, it has devastating mental health effects on children. And we have seen that. We saw that with COVID, and now we're seeing that again, where immigrant children don't feel safe. And immigrant parents don't feel safe. So we have essentially generational trauma, which we will continue to see for many years and decades. And I think, preventative services go down. People don't come to the hospital until they have to. Or even then, sometimes they don't, because they don't feel safe, and sometimes they don't feel welcome. Not as an individuals, but as a system. The structures there are just a little bit too hard, and the barriers become even more elevated. So, we're seeing the effects of that already. We see, children who are afraid, parents who are afraid and really feel like they are unable to protect their families. And at the same time, they're expected to go to school, go to work, function as normal human beings in society by really carrying this lack of safety. And psychologically, a lack of safety is one of the most difficult things to navigate in life. And I think we are seeing an entire population who is targeted for one reason or another. And even though people have certain levels of privileges, we know that some people, including myself, will be targeted for nothing else other than the way I look. When we talk about conversations about how to keep people safe, it's often not lost on me that if I'm in a room full of medical directors and ICE walks in, I'm going to be the one who's targeted, not anyone else, right? So I think even when you do have a certain level of privilege, your health and safety are consistently affected based on what else is going on around you. And this is one of the most difficult times that people have been in for one reason or another, when there's just a lack of safety and a lack of law, to be honest. I don't want to say too much, but I think it is everything that we've thought would never happen is kind of happening in front of our eyes. And I think in the past, when people would say, oh gosh, there's going to be this happening, or what if this happened, they would be called alarmists. And right now we've seen that, the bar keeps getting pushed. And I think every time it is scary. It is scary. We're at a place where people could lose Medicaid, all of Medicaid, and who will that affect? Where people have time where people could lose funding for a lot of very necessary medical support, where people might lose access to medications, and that will have devastating effects. And I am often afraid to think about how will we recover. I don't know if, I don't know when, but if this continues, I think we really have to stop and think, is there a time where we're going to be able to recover from not just the physical effects of what's going on politically, but the mental health effects and the effect that it's had on our community as a whole, because it does fracture a lot.
Yeah, thank you for sharing the jarring reality of the political nature. I recently did a qualitative analysis about how what's happening is impacting community groups. I mean, people share that they are genuinely scared to go to the doctors, they are scared to go to school, and how that has long-term impacts. Could each of you guys share what are the biggest barriers Somali immigrants right now are facing when trying to access healthcare?
I think it's, lack of safety right now, right? Many, thankfully, and again, I say this kind of with a heavy heart because it shouldn't matter. Most Somali immigrants are documented, so they have a certain level of safety when they are accessing, and then just when they are accessing certain things that they know that they are eligible for. So we have often it is, can you access the medical care or the health care that you need? Do you have the time off from work, the ability, the transportation, the language, and the ability to navigate a system that honestly, I'm not sure who these healthcare systems were built for, because they're extremely difficult to navigate, even if English is your first language. Even if you are well trained within the system, they're extremely difficult to navigate. But even after overcoming those 5 things that I mentioned, there is safety. As a Somali person, when you know that the President of the United States is continually invoking your community's name with nothing but negativity, and at some point people are, you don't know who is thinking of that and who is not thinking of that, and you don't know what you're going to be faced with if you're, navigating certain places. So I think it's a safety thing. It's also, will I meet bias and discrimination based on where I go? Even before I open my mouth. So people have said, I feel comfortable at that hospital, but I'm not going to that hospital because of prior experiences. And the Somali community is incredibly well connected. I say maybe there's 2 degrees of separation between us, honestly, between here and Minnesota and everywhere. So people know each other. So when there's a negative experience, even if it was one person, people will hear about that and they will collectively want to protect other community members from doing that. So then trying to rebuild trust when there has been a negative experience becomes increasingly more difficult.
Najma, could you also share if you have anything else to add, like what are the biggest barriers Somali immigrants are facing when trying to access healthcare?
Yeah, absolutely. I'll add, I think ongoing challenges with language access, but also deeper gaps in culturally responsive care. And we're seeing this more and more cases come through our case management program. We also see that our community members have, of course, like a level of mistrust that is shaped by past experiences or like lack of representation within the healthcare system. And like Dr. Anisa mentioned, really a really big barrier is just how difficult the system is to navigate, whether it's insurance or referrals or follow-up care. Many community members are left trying to manage these complex systems on their own. And we've seen time and time again, people just coming to Somali Health Board and needing assistance on how to navigate some of these things, whether it's insurance, understanding whether or not a specific procedure is going to be covered by their insurance, or if their medication is going to be covered. And families feel dismissed when they're trying to get more information directly from these healthcare institutions, or they feel that they're not fully heard when they are trying to advocate for their needs within these clinical settings. Recently, we had a case of where a family, a family who had a child with a cochlear implant. The family came to us after a few times of just feeling misunderstood, frustrated. They felt that the concerns were not taken seriously. And they wanted one of our case managers to attend the appointments with them as a health advocate, as a medical advocate. And one of our case managers does speak sign language. And she was able to really help them kind of communicate. And just having another person that's like, hey, this person is my medical advocate, automatically the tone in the conversation, that they felt that the tone from their physicians were, it shifted, right? They felt like all of a sudden they were getting a little bit more respect simply because they had another person there that was willing to advocate for them. And it went well. They were able to address their needs and they felt acknowledged because they had a representative there. But really that kind of support just highlights how critical advocacy can help in helping families successfully navigate care, in ensuring that and really to build on what Dr. Anisa mentioned earlier about the broader impacts that the political environment and how that's going to impact on how people engage with healthcare. It is really frightening to think about because there was already these social determinants of health, right? We're already seeing these gaps in care, and now with everything going on politically, we have to assume that unfortunately these things are going to be exacerbated. There is real fear in the community right now regarding immigration enforcement, and that directly affects whether families feel safe in seeking care. We've heard that from our community. Potentially only waiting until they feel like it's absolutely necessary to go to the hospital. And this is coming from pregnant women, right? Missing their appointments because they feel like concerned whether or not that they would be safe at the hospital. And when we talk about access, it's really not just whether, services exist, but it's also about making sure that the services that are there, they make people feel heard and they make people feel safe, and are able to successfully navigate the system. So there's a lot of work that needs to be done, but that's what we're hearing right now.
Thank you for sharing that. As we talked about a lot of the barriers that people experience, what can individuals in this room, whether they work in healthcare or not, what can they do to better support outcomes for the Somali community?
I mean, I guess I will, depends on what outcomes that you are thinking about, but I think that the advice that I will give during this time is that when a group of people are targeted, they need active allies. There are places and spaces that people with more privilege are going to feel safer, that they're going to be able to speak up, that they're going to be able to show up in a way that may be putting the Somali community leaders at risk, or other community members at risk. So I think this is really a time for strengthening allyship and really showing up and using your privilege if you have it for good. And if you don't have it, being those silent supporters. So, I think there is this political advocacy, right? Advocating for policies that are anti-bias, but also support healthcare as a whole, because if healthcare is supported as a whole, of course, the Somali community will also benefit from that. Then there is that kind of support where I will support local organizations, whether it is financially or whether it is with my time, whether it is funding opportunities, or whether it's just sponsorship, saying that organization's name in spaces where we might not be present. And then the third is just really advocacy within our own realms, right? Whatever you do, there is a space to actually speak up for a specific community and think about which voices are not being heard, and are those people who are closest to the pain, closest to the power. Because structurally, what we have seen is the people who are feeling or experiencing the most pain from any given situation are often not in the rooms where decisions are being made about their care or their access or their resources. So really ensuring, how can I bring those closest to the pain, closest to the power? Because what better way for, somebody from X community, or you can name it, right? Somebody with diabetes, right? Or somebody who is an immigrant, or somebody who has a language issue. What better way to highlight that issue than have someone who is directly impacted by it speaking it and being in those rooms, or mentioning their names in those rooms where those things are most important. So I think there's many different ways to speak about this, and there's many different ways to support the community. So it's really what level that you are interested in doing this. But first and foremost, I would say use your privilege for good. There are many things that someone who does not look like me can do. It is not fair, but there are some times when I'm standing in a room and I say, I can say this 1,000 times and I will not have the safety or be heard in a certain way. But if there's another person who has a privilege that I do not, they will be heard. And this is a time to partner with people and use that privilege that you have to say, how can I amplify? Not speak for you, not empower you, because there's powers within the community, but how can I amplify what this community has and use my privilege to help support that, because I have the privilege of being more visible and still feeling safe within that visibility.
Yeah, I think Dr. Anisa really mentioned a lot of the points that I was going to make. One thing that I'll also add, in addition to allyship and using our privilege, and partnering with and supporting community-based organizations, is also to invest in culturally responsive approaches, making sure that beyond language access, that there is investment in understanding context and building trust. And, as an individual, even if you aren't necessarily in the healthcare field, but doing that education yourself. And if you are in places of decision making, ensuring that community voice is a part of that, not just as partners, but also as leaders, and continuously mentioning the work that local organizations are doing and amplifying their work. And for those who are in healthcare, I would say really making sure that you're taking that extra step to make sure that your patients actually understand what is being said and can follow through with their care. And that might mean slowing down, checking for understanding, helping coordinate next steps, like referrals, connecting patients to community-based support, instead of assuming that they'll navigate it on their own. that is really a lot of what we're seeing from our community, because the gap is not only, accessing the care and making that first step to actually showing up to the appointment, but it's also very much what happens after the appointment. And I think all of these small changes would significantly improve outcomes.
Thank you. We are getting some amazing questions from the audience. So I just wanted to pick a few and ask a few questions.
So why don't you review those questions for a minute and let us jump in with a quick pitch. I will remove you from the spotlight and let you go through the chat, and then we will come back in just a couple of minutes and start that Q&A session. But thank you so much we know as advocates for the healthcare, trying to reform the healthcare system, that the social determinants of health are important. We've even addressed political determinants of health. It's so powerful to add safety to our list of issues that we really, really need to highlight. I think that this has been a great program so far. I'm looking forward to the Q&A session. So let's introduce Peter Lucas, who is our treasurer on the board of Healthcare for All Washington. Peter is joining us from Mexico, but he's here, standing by us.
I'm here in spirit. Well, you've all heard my pitches before, those of you who've been at these webinars, but I really want to thank you, Najma, Amina, and Anisa, for the discussion of the Somali community in Seattle and the challenges you face, pretty severe ones. You very well described how fascist politics and racism adversely affect the health and welfare of your community. And I think all of us are inspired by your activism in addressing those injustices and advocating for your community. Healthcare for All has also advocated for health justice in part by our support of legislative actions since we were established in 1994. Including the Washington Health Security Trust, which is a bill that we wrote to create a single-payer system in our state. We also helped create the Universal Healthcare Commission and continue to be active participants in its mission to establish a proposal for universal healthcare in our state. And we strongly advocate for it to be the aforementioned single-payer plan. And we've been pleased recently to see a lot more people stepping up to volunteer for our organization. And there are many opportunities within our organization for you to make a difference, such as helping us develop legislation, educate, outreach, and development activities, which include recruiting more supporters and fundraising. Our professional lobbyist, Lonnie Johns Brown, as well as our board members, volunteers, and supporters, maintain close contact with legislators, providing education and guidance in drafting bills and enlisting allies in Olympia. We've been involved in the creation and enactment of many progressive healthcare reforms, and we're very fortunate to have forged strong bonds with many Washington state legislators who support our mission. And all these activities require some money. We have a lobbyist that we pay, and we have a communications specialist. And our donors provide the financial support for them and other activities, for instance, these monthly webinars. So please help us continue this work by making a donation tonight, and we certainly encourage not just one-time donations, but recurring donations that provide support throughout the year. And I put a few links in the chart in the chat, and you can also just go to our website and click on the button. Together, we can achieve low, cost-effective, high-quality universal health care coverage in Washington state. And thank you so much for your support.
Thanks so much, Peter. And go into the chat. You can still add a few more questions, but let's bring the panel back on. And if we can bring Amina and Anisa and Najma back. And I'd also like to introduce a fourth person who's going to help them coordinate some of the chat, a volunteer in our healthcare reform system, Cello Echeverria. So if we could highlight all of them, I will disappear again.
Hi, Anisa.
So you guys have asked so many amazing questions in the chat, and unfortunately, we can only get to a few of them. But I think this one was a very specific one that I was hoping, Anisa, maybe you could answer. At the bedside of a patient, pregnant mother, or newborn from the Somali community, are there specific things that the clinician should know as to help with the patient-doctor relationship? I feel like as a mother and as a clinician and as a Somali American, you'd be the perfect person to answer.
I think, first and foremost, it is an understanding of like the cultural and religious practices of women, and understanding which framework this mother is coming into, both her pregnancy, but then also accessing allopathic medicine, which I think some part of that really depends on, how long has this woman been here? How is she more recently arrived, in which the entire system of prenatal care and visits every month and 1,000 tests, et cetera, might be foreign to her based on where she lived before and raised. Or it might, or she might know a lot more about it. To who are we getting gender congruent care? So, first and foremost, Islam will allow necessary medical care from a medical professional, regardless of gender, period. Like if you have no other options. However, many pregnant women and many women might actually choose to have a physician that is gender congruent for many issues, including the ability to talk about things freely, women's health, health after the baby, issues that have to do with obstetric or gynecological care, but then also the modesty of an exam. Many women will feel much more comfortable having a female provider. That being said, emergency cases, care where there's only a male doctor available, of course, that is allowed, but her comfort might vary with that. And then second, I think it is just creating a safe enough space to be able to talk about what they find most helpful. I think that often we are afraid to ask, and we should not assume. I truly don't believe that there is any person that is 100% competent in any culture. So I think we should really just throw away the cultural competency phrase and say this, you have to approach things with cultural humility and be willing to learn, because I am taught on a daily basis about Somali culture by an elder who walks in and says, this is what we do. And then we come to you guys after we do this, or you should be approaching this a different way, or let's think about this, as a bigger community. So you're often learning even within your own culture. So of course you're cross-culturally learning. So what I've learned in my years of clinical practice is really, you have to create rapport and the safe space. And then you have to ask and have that family know that I genuinely would like to know so that I can provide good care for you. So an open-ended question like, I'm new to meeting you. What would be important for me to know about you or your culture or your beliefs so that I can take the best care of you possible. And I think even that one sentence really does open it up for create a safe space and opens up opportunity for conversation, even if it doesn't happen that day. You've just set the precedence for, I want to know more about you. And then that's an invitation. It's not expectation. It's an invitation to share more should they want to. So I think the cultural humility, the asking and not assuming, and then also just taking time to learn about certain cultures. Ethnomed.org is a wonderful website run by Harborview, and Ethnomed has a ton of information. It has country profiles. It has certain disease topics, and just taking a couple of minutes to look at that and say, what can I learn, just so I can have a little bit of a framework for it, is an important step.
Thank you so much for answering that. And you also talked a little bit about gender congruency, which was another question that was asked. So got kind of tied it in perfectly. Najma, a question that came up was, does the state provide funding to the Somali Health Board to support services and programming? And if so, has that funding changed recently? And if it has changed, what effects are there on services and programming?
Yeah, that's a great question. So Somali Health Board gets funded, majority of our funding comes from government contracts, including King County, which funds most of our programs. We also have some funding from the Department of Health. In terms of the loss of funding, yes, unfortunately, and we're seeing that across a lot of nonprofits, that cuts to federal funding have directly impacted our programs as well, specifically our senior health promotion program, which we lost as of last month. And it was like an abrupt notice that was specifically because of federal funding, and it was tied through the Seattle Housing Authority. And this program was a program that met the elders in our community where they were. So this was at specific Seattle Housing Authority locations, one in New Hawley, and the other in the Rainier Vista location. And this was a program that provided not only health education, so nutrition, exercise classes that they met twice a week, but also was a space for social connection. And that is a lot of what we've been hearing from our elders, unfortunately, since this program was cut, was that this was more than just exercise and nutrition classes, right? This was a space for social and emotional connection. The only opportunity that we get to talk to other people and feel less lonely. And so, unfortunately, that is something that we're currently navigating and trying to figure out how can we use what we have to do some sort of um, just provide the service in a lower format and with the capacity that we do have. We're currently always trying to advocate and continue conversations to see if we can receive bridge funding, but that is currently one of the biggest losses. We also, at the end of last year, faced a funding cut with our mental health program. And so our mental health program has different support groups. So we have a youth support group as well as parent support groups, and all of our support groups are with a licensed mental health therapist, culturally responsive, like Somali licensed mental health therapist. And so we've been able to continue that programming. It's just been on a less frequent basis, so quarterly instead of like monthly support groups. And but those are some of the two of the programs recently that we faced funding cuts. Also, I saw a question about, I'll just go ahead and answer. I saw a question about the board and if we're um, uh, looking for a board of directors. We are currently recruiting for board of directors. If anyone's interested, I could put my email in the chat. And then I think I saw a question about the founding of Somali Health Board and how many board members we do have. Somali Health Board was founded in 2009, I believe, and then officially as a 501(c)(3) 2012. Um, and we currently have 21 employees, 19 who are full-time. So it's been tremendous growth over the last 5 years. Majority of these employees are after 2020. And that really has to do with a lot of the COVID-19 work that we were doing across the state, collaborating with Othello Pharmacy to ensure that our communities were getting vaccinated. And then to answer your question about how many board members, currently we have 5 board members. We range between 5 and 7. So we are recruiting for some more board members. And if you're interested, I'll put my email in the chat and we could talk.
Awesome. And Somali Health Board will be having its annual gala at some point this year. So keep an eye out, recheck the website in the next few months and support them at their gala. I wanted to end off with one question. And it is, with so many systematic barriers, the political environment that we talked about, social determinants of health, so on and so forth, list can go on. What gives you both hope during this time?
Well, I'll answer. Well, I'll connect it back to something that Najma just said. If you guys noticed, there was a time period between when Somali Health Board was founded and the time in which we became a 501(c)(3. And that was very intentional. And it was because we did not want, we wanted to build trust within our communities and our community members and people who have been historically marginalized and often used by healthcare systems and places and things, to really say, we're not doing this to become an entity that then gets grants and makes money, et cetera. And because many of us were kind of in this younger generation 1.5, I think it gave us a great time for people to kind of give us like a talking to, right? Like they were very much like, listen, I know you guys want to teach us about diabetes, but until we figure out why the C-section rate is so high, we're not talking to you guys, right? It really brought us in and to say, this is what we want to do. If you guys really are, if you mean it, you want to talk to us, if you want to do this, let's address these things first. And I think that power and potential is really what keeps me going, right? Because if you looked at it, there were public health professionals, there were pharmacists, medical students, people like that who were at the front and center of Somali Health Board and the community and the Somali community in general. But the people who were actually making this meaningful change and made so many things that the youth were doing, our pharmacy schools, all of these things, our people who were going to pharmacy school, our education's possible, were these quiet members who did not often even have a formal education, who experienced the worst of the worst and lost everything in a war and came to the United States and really said, by God, we're going to make our children great. And we are going to ensure, sorry, that whole make people great really is not a great tagline anymore. But, they said, we are going to make sure they have the support that we did, and we're going to give them everything that they need. And the thing that makes me the most proud about many communities, but specifically my Somali community, is that we have this pride and perseverance where, it's like, sit up, get your chest out, puff your chest out, we're going to do this and we will get this done. And even in the hardest moments, I think when you look at the community as a whole and how we often come together, just recently there was a nonverbal autistic child missing, 16 years old, and the entire community came together and said, we need to find this kid. And it didn't matter if knew the kid or not. It was just that it's time to, pull up our sleeves and get this done. And that's really what often keeps me going, because I know that that's what the community does. And I know that's when many communities do. We saw this with, Minnesota and ICE enforcement. They really just come together, and it's that drive and that kind of community resistance and energy that often keeps me going, and saying that even if I'm tired today, there is a group of people that will continue to do this, and I can pick up where I left off, because it's not just me and it's not just us. It's really truly the people that surround us and support us.
Yeah, not sure how to follow that because that was perfectly said. But yeah, honestly, what makes me proud to be Somali is the sense of identity and groundedness that comes with it. There's a strong connection to culture and language and faith across our generations, even in the diaspora. And I really take a lot of pride in how our community creates opportunity out of very, very limited resources, whether that's through entrepreneurship, community networks, or supporting one another and navigating new systems. I'm thinking about the Tukwila area and how a few decades ago that was considered a dangerous area. And Somali businesses created cultural hubs. They've made it safer. And now look at Tukwila with the light rail and all of these new fancy apartments. And every community, every area where there are Somalis, there are entrepreneurs, there is cultural impact there, and really that just seeing that is a beautiful thing. And for me personally, I think it's just seeing how that foundation of, growing up around resilient people that can make anything beautiful, and how that translates into the work that I'm doing, into leadership, people always stepping in, like Somali people stepping into spaces that they weren't always expected in, right? Like Dr. Anisa, you're the director, like the first ever Black director, is that correct? Like of the pediatric clinic, and we're seeing more and more like representation in locally, and I think that's really beautiful, and people just showing up and being in spaces that they weren't expected to be in, and doing it with purpose. So that is something that I carry with me in my work, and that's what makes me really proud to be Somali.
Najma and Dr. Anisa, thank you guys so much for this amazing and fruitful conversation. I love listening to you guys. I love moderating this conversation. Thank you so much.
Thank you for, and what gives me hope is to see the community growing like that. And where we're losing pharmacies in the rest of Seattle, we seeing new pharmacies in Tukwila, and it's just it's just inspiring. So thank you for your contribution tonight, and we count us as in line to help support issues that come up. So thank you. So as we take them off spotlight, take our speakers off spotlight, thank you again. Healthcare for All will have another Zoom session. It'll be the second Wednesday in April, which is April the 8th. We will focus on how a collaborative care model can support primary care. We've been looking at primary care clinics in a number of different communities. Tonight's conversation has led us beyond just the healthcare. The social and political determinants of health have been added in here. So thank you for that contribution tonight. Join us on April 8th. Dr. Anna Ratzliff, who's the co-director of the UW's AIM Center, the Advanced Integrated Mental Health Services, a program to support primary care providers in providing behavioral health services. And so join us that evening. And David, can you, and I'd certainly like to thank all of our volunteers who helped out tonight, in addition to, this great presentation that Amina, you helped develop, and that Anisa and Najma, you really inspired us. So thank you again. And David, can I give you the final word?
I don't know if it'll be the final word, but anyway, PNHP Washington has monthly meetings for 15 years, and our one next month is on April 15th, the third Wednesday. We put that there, so the second Wednesday would be open for Healthcare for All Washington. So next month, our speaker will be Carrie Wallace, who's the chair of Whole Washington, who will update us on the Washington Health Trust as it came through this last legislative session. You can also find a link on our website that I put in the chat to last night's video that unveiled PNHP's just released report on moral injury in medicine, the human cost of practicing in a profit-driven system. And this is going to get a whole lot of publication and people talking about it, because it interviewed over 1,300 physicians and other types of providers to find out how pressure comes from financial places like insurance companies, and they might be in a practice that is for profit or owned by a for profit. Pressure on them to not be able to give the care they know their patients needs, and they want to give their patients, but these financial constraints stop that. But we're hoping that these can be removed and we can get back to where you don't have to jump through pre-authorization or try something that's cheaper first, and we can just give our patients the care they really need. And this is having big consequences on doctors as well as their patients, because 40% of them are thinking about leaving the profession because it's getting so bad like this. But PNHP and Healthcare for All Washington are going to change this, right, Ronnie?
And our other allies. So it takes a village. It takes more than a village to make this change. And
yeah,
so
we should give a shout out to Healthcare for All Washington, or is a Human Right Washington, which is a coalition of 40 organizations in our state that are pushing for progressive changes in our healthcare system, and particularly single payer that most of us here have been working on for years.
And thank all of you for taking the time and for being.
Ronnie,
interested in this. Sure,
Can I just jump
Cello.
in? Yeah, I just put in the chat the link directly to the moral injury report. It was really, really good. The presentation was excellent. And also, don't forget our snappers over in UW Medicine, and please come and be active with them as well because they're amazing.
Well, thank you all. Thank you again. Good night.
Good night.